So to start for the pre-inductory phase, first is we review the client's previous medical records if available. This is to identify your client's past health history and your current lifestyle. So next is to determine the scope of the assessment. So for today, we will be having an assessment for the anterior and posterior thorax. So we will be using the IPPA, which means the inspection, palpation, percussion, and auscultate. Then, to prepare the materials needed during the assessment. So the materials needed that are needed are the stethoscope, the marker for the body, and a ruler. Lastly is wash your hands to prevent the spread of microorganisms. So to start for our assessment is first we greet the clients politely, then we introduce ourselves, then verify client's identity, then ask how he or she wants to be called during the assessment. So good morning sir. I am Ronald James Ibonio, your student nurse for today. So can I verify your name?
I'm Bradley Weaver.
Yes. Your birthday?
June 30, 2001.
Age?
20 years old.
Okay, sir. Thank you. And how you want to be called during our assessment?
You can call me Brad.
Okay, thank you, Sir Brad. So next will be explain the procedure and how the patient would be participating during our assessment. So for today, sir, we will be having a thorax assessment. So I want you to stand up, to sit down, to lie, and to take off your shirt if it's okay for you. Okay? And I will be asking questions during our assessment. Is it okay for you, sir?
Yes, okay.
So do you have any concerns, questions, clarifications before we start our assessment?
None so far.
Okay, sir. Thank you. So next will be ensure clients' privacy confidentiality. So, sir, before we start, can I close the door for our privacy in here?
Yeah.
Okay, thank you, sir. So to start for our working phase, first is we check for any respiratory distress or problems with oxygenation. This is to determine if there are any problems for the patient's breathing, lungs, oxygenations, and respiratory. So, sir, can I look into your face, your lips, your fingernails? Okay, thank you. Next is to palpate the suprasternal notch and to determine the position of trachea. So I will be palpating your suprasternal notch, sir. Do you have any difficulties in breathing?
None.
Okay. Next, we'll be inspecting for the configuration. So first is observe the client's scapulae and the shape and configuration of the chest wall. So first is stand behind the client and observe, then at the side. So next is observe for the three curvature, which are the cervical, thoracic, and the lumbar. So this is to determine if there are any problems for abnormal curvature. So next will be assessing for lateral deviation of spine. So ask your clients to bend forward at the waistline and observe from behind. So, sir, can you bend forward for about like waistline? Okay. So I'm just looking for any deviation and abnormal curvature. So can you stand back? Okay, thank you. Next is to palpate for the posterior thorax. So first is assess the temperature and integrity for all chest skin. Next is palpate for all the thorax area for bulges, tenderness, and abnormal movement. This is to determine if the clients have any respiratory complaints. Next is place both hands over the lower thorax. Then thumb must be adjacent and fingers are spread laterally. So next is ask the client to breathe deeply and observe the movement of your hands. So sir, can you inhale deep, exhale. So inhale, exhale. Okay, thank you. Next is to palpate the thorax for vocal fremitus. So first is place your palmar surface in your fingertip in near the apex of the lungs. Then next is ask the client to repeat the word 1, 2, 3. Then repeat the steps while moving your hands sequentially. This is to compare the fremitus to determine if there are any decreased or absent fremitus. So, sir, can you repeat the word 1, 2, 3 whenever I touch your back? Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, sir. Thank you. Next is to percuss for the posterior thorax. So first is ask your client to bend his hand forward and fold his arms forward across his chest. So sir, can you bend your head and fold your arms across your chest? Okay, like that. Thank you, sir. Next is percuss the posterior thorax intervals in a symmetric position. Next is for comparing the one side of the lung to the other. Then next is percuss for the lateral thorax every few inches. Okay. Next is to measure the level of diaphragmatic excursion. So first is use a percussion to identify the level of the diaphragm and to measure the diaphragmatic excursion. So start from above to downwards. Then next is to mark the full level of expiration. Next is ask the client to inhale deeply and hold it on. Then percuss downward to identify the full level of inspiration and mark it. So sir, can you inhale deeply and hold it on? Okay. So next is repeat the process on the other side. Then after is measure the distance between the expiratory and inspiratory level of dullness. So sir, exhale. Can you exhale? Can you inhale deeply and hold it on? next is to auscultate for breath sound. So first is place the diaphragm of your stethoscope at the posterior thorax at the apex of the lungs at C7. Next is to ask the client to breathe deeply with their mouth open. So sir, can you breathe deeply with your mouth open while we are moving our stethoscope? Okay, thank you. The next is listen at each point of breath sound during the complete inspiration and expiration. So sir, let's begin. So breathe. Exhale. Breathe. Exhale. Breathe. Exhale. Okay, thank you, sir. So, next is to compare the findings of at each points with the corresponding point at the opposite side of the thorax. Next is auscultate the voice sound. So, first is bronchophony. So, ask the client to repeat the word 99 while auscultating the chest wall. Okay, sir. Can you repeat the word 99? So, start.
99, 99, 99, 99, 99.
Okay, thank you. Next is egophony. So, ask the client to repeat the letter E while we listen for the chest wall. So, sir, so just repeat the word letter E while I'm listening for your chest wall. So, start.
E, 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 E.
Okay, thank you. And lastly, we have the whisper polyloquy. So, ask the client to whisper the word 1, 2, 3 and listen at the chest wall. So, sir, can you just whisper the word 1, 2, 3 while I'm listening to your chest wall? Okay, start. Okay, thank you. Next is the anterior thorax. Lie down. Next is for the anterior thorax. So first is to inspect for his respiratory breathing to ensure if there are any problems in breathing for the clients. Next is for inspect for the costal angle. So next is to palpate for the anterior thorax. So first is using your fingernails. So next is palpating the anterior thorax. So using your fingers to palpate the tenderness and sensation. So start palpating at the left side of the clavicle. So sir, just tell me if it hurts anywhere. Okay. Then start moving your both hands systematically downward at the midline, then outward at the lower part of the breast. Then repeat the process in crepitus and firmitus. So next is prepare the anterior thorax for respiratory excretion. So place the palm of both of your hands on the lower anterior thorax. Then your fingers are laterally on the rib cage while the thumb is on the costal margin. Then ask the client to breathe deeply and observe the movement of your hands. So sir, can you breathe deeply? Exhale. Okay, thank you. Next is percuss the anterior thorax. Begin percussing at the clavicle in the supraclavicular space and proceed downward to the diaphragm. So, just tell me if it hurts, sir. So next is auscultate for anterior breath. So first is auscultate the trachea. Then auscultate the anterior thorax. So place the diaphragm of the stethoscope on the anterior thorax. So on the anterior chest wall. So like this. Then auscultate from the apices of the lungs slightly above the clavicle in the base of the lungs at the sixth rate. So ask then like this. Then ask the client to breathe deeply through the mouth. So sir, is it okay for you if you breathe deeply through the mouth? Okay, start. See. Start. See. Start. See. Start. Exhale. Start. See. Start. See. Start. See. Start. See. Okay, thank you. Now listen at the side, at each side for at least one respiratory cycle. So breathe. Release. See. Breathe. See. Okay, thank you, sir. So for summary and closing phase is first is summarize all the data that been gathered during the assessment. So good afternoon, sir, once again. So let me summarize all the data that I've been gathered during our assessment. So first is your spine is vertically aligned, so it is straight. So while I'm palpating your anterior and posterior thorax, your skin is intact. So and temperature is normal, and there's no tenderness and masses. Okay. So for when I auscultate your thorax, it is normal. So your breathing is normal and silent, and no signs of difficulty in breathing. So everything is normal under the thorax. Okay, sir. So next is provide the client the opportunity to raise some questions, concern. So, sir, do you have any questions, clarifications before we end our assessment?
No, I don't have any questions.
Okay, sir, thank you. Then lastly is thank the client and end the assessment. So, thank you, sir. So, if there are any problems, just don't hesitate to come back and we'll have an assessment. Okay, sir, thank you.